Vulnerable communities remain at the greatest risk. We're talking about disabled people, young people, Māori and Pacific communities, most of whom are based here where I'm the councillor in South Auckland. I think my disappointment is fueled by the fact that this is an opportunity for the government to really lead the way, lead the world, in fact, on how to prioritise the needs, the health needs of Māori and Pacific, more vulnerable communities. And so I'm disappointed that we've left the strategy to get elimination, and I'm hopeful that we'll be able to lift vaccination rates, because that's what's seriously needed in my part of the community.
So the way the government has dealt with the crisis so far, has this been the case throughout the pandemic? It's been quite consistent, or have we seen cases among those communities that you mentioned worsen with the Delta strain?
What we know is that South Auckland is the front line to the COVID-19 battle. And my issue has been that the Ministry of Health have, from the very beginning, failed to include the voices, the expertise of Māori and Pacific Island people. And because of that, we're being tacked on towards the end to really boost our numbers of vaccination. Look, we're doing all right as Pacific people. We're at about 72%. The average is at 78%. And Māori are way down at 56%. And so we've got to have a specific strategy to reach hard to get to communities. That hasn't happened. We've now got these community organisations involved. They've been tacked on at the end, and this is often the problem when their voices are missing from the planning and the design stages.
And what factors are compounding the situation for them?
Yeah, well, there's a number of things. There's hesitancy. We've seen a decline. The research is telling us that there's a decline in the levels of hesitancy. We've seen historical levels of distrust that many of these migrant Indigenous communities have had with public institutions for a long time. And I think they're just generally hard to reach communities. So we've got to have an approach that really gets people involved, whether it's sticks or carrots. It's important that people feel like a vaccination is available to them. We make it easy to get to them, and we have local organisations who are trusted by the officials to go out and to speak in the languages that these people understand, warm them up and get them to come in. So that needs to be the strategy from this time forward.
And you mentioned before that you think it's too early to abandon the elimination strategy. How would you like to see it dealt with in the coming weeks and months then?
Yeah, as I said, this is New Zealand's chance to really show the rest of the world this is how you prioritise vulnerable communities. And that means we're asking for forbearance from the rest of New Zealand. And I know it's been tough for many people. It's been tough for my family, many communities here in South Auckland. But what's really important is that we get this strategy right. So it means that sometimes we're going to have to give up some freedoms. We're going to have to be forbearing in the way we treat other people. But that's really important if we're going to have high vaccination rates to ensure that the people at the front of the battle for COVID-19 in New Zealand are protected foremost, because if you're in the middle of the battle, you're not going to see and sometimes appreciate what's going on in the front lines.
And as a leader among your community, what kind of stories have you heard from people who are trying to deal with the pandemic?
It's been tough for many people. We know that we've seen a record number of people requesting food parcels and support packages. Today, some of the restrictions were lifted slightly in Auckland. We went next door with our daughters to the playground and noticed that no one was there. And I think what that says is there's a real weariness in South Auckland that we haven't quite got the strategy right yet, that people are fearful, that they know that there's been community outbreaks here, and so we've got to get it right. And so my plea to the government is to ensure that we're doing everything possible, talking to the people on the ground in the community and with trusted local organisations who are going to reach the community so that we can increase our vaccination rates.
What else would you like to see the government doing to turn around all these somewhat concerning statistics that you've described for us tonight?
Well, they've got to lift levels of trust, and that's only going to happen when we've got Māori and Pacific Island vulnerable communities' voices at the planning stages around the decision-making table. That's one end of it. The other end is resourcing the local organisations so that they can get out into the community. We've got the Shot Bro or Shot Cuz buses that are moving around, going to high schools and shopping centres, and you're able to get your vaccination at the bus. So that's one of the ideas that came because we got community organisations involved, and that's where they're going to have to get their intelligence, local people, local intelligence reaching locals.
Overall, though, are you confident in New Zealand's handling of the pandemic compared to other countries in the region?
I've been really happy with the way in which we've gone about constructing our strategy for elimination up until this stage. Look, it's been hard for many New Zealanders, and I'm thankful for all the efforts that people have put in, but we've just got to get that last group of people who are often hard to reach, and that's going to require patience and forbearance. And I know it's tough on people. I know people are feeling like their movements are restricted, but my request to everybody is to just hold off a little bit longer so that we can reach those communities that have been traditionally missed out and marginalised, and ensure that they're safe, well and vaccinated.
Efeso Collins, thanks so much for talking to us.
Thank you.